Hi, I'm Deepshika Katwal. I'm a student nurse. I'm currently pursuing my master degree in University of Wollongong, and going to conduct a focus assessment as a part of my subject assessment. And in for this, I have got a patient whose name is Harry, and he's 44 years old. Took his family health history. Then I came to know that he had the family history of cardiovascular disease. While taking his objective data, he was found very pale. Family health history of the patient. It is important to know the condition of his heart. I took a proper consent from him before I conduct any focused cardiovascular assessment. First, when I took a consent from my patient, then I made him feel comfortable with me and told him that it's just assessment and we'll try to find out that what is wrong with him. So I asked my patient to lie on the bed in superior position with his trunk at 45-degree angle, and also asked him to expose his waist usually up. And after that, I looked for the pulsation that usually occurs in several waves in each cardiac cycle. I observed that patient while he was lying on the bed and was like cyanosed or not, and if his respiration rate was normal in a normal pattern or not. While observing, I observed his pulsation and retraction, and also I observed the symmetry of movement of chest wall while he was lying. He still looked pale and sweaty at that time. I asked if he had this type of pain in his extremities while he was performing any other activities, or is just like while it is present for now. And after that, I inspected the patient's hand. It was very warm. I examined extremities by observing if there is any anterior or venous disorder, noting the different kind of symmetry, edema, lesions, weeping, and if any scars is present. I checked if there is any nail rubbings like splinter hemorrhage or palmar erythema, Janeway lesions, and axillary nodes. I checked the patient extremities and by assessing his skin temperature, texture, turgor for edema, and his capillary refill of the patient was also checked by pressing the nail base on fingers and toes, and usually the refill time should be 3 seconds, but it was less in his case. And in this focus assessment, after inspecting my patient, I went for the palpation stage. And in palpation, usually people are like overlooking the palpation, but it is very important aspect of the cardiovascular assessment and it should not be overlooked. So I palpate the apical impulse and note the size, location, intensity, amplitude, and duration of this pulse. The radical pulse was taken and it is used to assess the rate and rhythm. Collapsing pulse is very important to be taken as it is a sign of aortic incompetence. And after this, I assess the pain of my patient. I place the palm of mine over it and raise the arm above the patient head. A collapsing pulse will be present as a knocking on your palm if he had any kind of abnormality. Then after that, I examine the extensor aspect of the elbow if any evidence of xanthomata, and I again took his blood pressure after some time, but it was still high to 164 by 100. And then I went to look for the signs of any jaundice or anemia, corneal arcus, xanthalsemia. And while I was looking at the face of my patient, I checked if he had any kind of malar facies, and I check his mouth for any signs and symptoms of anemia or glossitis, and I also check the color of the tongue for any cyanosis presence or not. And after the checking of this glossitis, I also check around the mouth of my patient if he has any kind of angular stomatitis, which is also a sign of anemia. And then I went to his neck, my patient's neck, and I assessed if he had any jugular venous pressure present in his neck or not. So I asked him to turn his head to look away from me. I just had a look across the neck between two heads of sternocleidomastoid. And after assessing his neck, if there is presence of any jugular venous pressure or not, I moved my further assessment to his chest area. or we can say precordium in the cardiovascular section. For this, I inspect the area of his chest, particularly looking for any obvious pulsation or not, if there is any abnormalities or not, if there is any presence of scars, and also check his axially as well. And after inspecting and examining the chest of my patient, I started to do the palpation precordium region. I try to first find and locate peak. I started to locate this apex peak by putting my entire hand, and I started to palpate for presence of any hips or thrills. I can explain a thrill is like a palpable murmur kind of sound that we can hear from our heart, and whereas a hip is a sign of like left ventricular hypertrophy, a thrill is something like you feel like a vibration, and a hip feels like an abnormally large beating of the heart. And after that, I went for auscultation. While performing the auscultation, I performed for all the four valves of the heart, like mitral valve, tricuspid valve, pulmonary, and aortic valve. And while doing the auscultation, I check for the mitral stenosis presence or not. So I asked my patient to lie on his left and ask him to breathe in and out and then hold it, and till I can listen the sound over his apex and axilla with my stethoscope. And after analyzing there is presence of any mitral stenosis or not, I went to check for the another aortic incompetence in his heart or not. And after that, checking his any incompetence in the mitral stenosis or not, I went to check for the another incompetence in the aortic region. So I asked my patient to sit forward in the similar way and repeat his breath in and out and hold it till I listened these different kind of sounds from my stethoscope over the Erb's point of the heart. Checking any kind of aortic incompetence in his heart or not, I went to assess for his oedema, and I asked my patient to sat forward, and I listened to the long basis for pulmonary oedema. I could feel the sacrum of the oedema, and I also assessed the ankles and the palm regions for the same, if there is any kind of presence of oedema or not. And after performing and checking this oedema, I asked my patient to think and relax for some time, and I also thank him that he allowed me do this cardiac assessment, and I allow him to dress properly. And after that, I wash my hands after finding these findings, as there was a bit kind of abnormalities in his objective data. So I again asked him to take an ECG, so that we can know the further information. So I arranged the ECG for him, and I just thank my patient for allowing me do the cardiovascular assessment. And if there is any further investigation confirmed from ECG, then I asked him that I will let him know. So I just performed a cardiovascular assessment in my patient, and let me summarize this. When Harry came to me, he has a complaint of a severe back pain, and his BMI was also high. It was 29, which indicates he was very obese. And after that his pain score was taken, which was 9/10, and even his pain was radiating to his back of his shoulder and arm. And after that, I asked his consent and took his to ask for this physical assessment. And after that, I assessed for his pain, I inspected him, and after that I checked his fingers for any abnormalities or not. Then I asked for his finger clubbing or not. Then after that, I assess his skin temperature, capillary refill, and then I went to check his radial pulse, radial pulse, and then collapsing pulse, and if he has any kind of hepatojugular reflex, there is presence of jugular venous pressure or not, by keeping him at the angle of 45 degree. Then I went to inspect his eyes and his mouth, and after that his chest. I inspected his scars. I asked him to lift his left arm and right arm, whereas had a severe pain while lifting his left arm. After that, I palpate his apex beat, and after that, I went to assess for a parasternal heave, and I also assess the thrill sound in his each four valves of his heart, which are mitral valve, tricuspid valve, pulmonary valve, and aortic valve. And after that, I repeated this auscultation in all the four valves by putting my stethoscope up to the bell by using my bell. And after that, I auscultate the if there is any kind of aortic incompetence. And after that, I ask my patient to sit comfortably, and I check for the for the presence of any kind of oedema. And then after checking the oedema, I asked my patient to dress up, and his assessment was completed. And now the further investigation will be continued after the ECG is done in him. Thank you.